Hello, my name's Ruth Broom. I'm the lead urology nurse specialist and continence advisor at the Norfolk and Norwich Hospital. And I'd like to thank you all for the invitation today to speak to you about incontinence and falls. This is one of my favourite pictures. I use it quite a lot in presentations because it makes me smile. They're obviously all on the continent, having drinks, which is a very different reason to falling than we're talking about today. However, if you look at the picture, there are actually 13 people in this picture, which means that between 3 and 4 of these people are going to suffer from incontinence of bladder or bowel. Quite like to look at all their faces and decide who's got what and who can smell what. So I'll let you have a look and see who you think it is. So what we're going to talk about is incontinence and falls. So what has incontinence got to do with fall prevention? And quite a bit if you think about it. People running to the bathroom or slipping on wet floors are likely causes for falls. These then are resulting in injuries, and I think this is happening a lot more often than people actually admit. Problems with the bladder and the bowel control can impact on a patient's ability really to stay active, healthy, independent. It can really make a big impact on what people feel confident to be able to do, and not let everybody know that they've got urinary fecal incontinence. Um, sorry. There have been papers, various papers written about incontinence of urinary frequency with regards to people that live in care facilities, so be that residential homes or nursing homes. Assisted toileting has been identified as a big risk factor for a falls increase for those people. So what I wanted to do first was just speak to you all about the different kinds of incontinence, um, and what we can help do to control it or to try and resolve it for people, so that it isn't an issue. So when we describe incontinence, it is a partial or incomplete loss of the bladder or bowel control. For some people, there's a huge amount of difference between people who leak a little bit and people who have complete loss of control of their bladder or bowel. It's important for us all to remember that incontinence itself isn't a disease or a syndrome, it is a condition, and it's a symptom of one of many other medical issues. There's lots of reasons as to why people are incontinent, and of course, medication can also make people incontinent. If you think of simple things like water tablets, diuretics that you take for your heart and your blood pressure sometimes, and you swollen ankles and things. These medications make you go to the toilet more frequently, which for some people is enough to tip them over the edge into being able to reach the toilet in time. Incontinence affects more than 14 million people in the UK, and 1 out of every 3 people, it's suspected, experience a loss of bladder control at some point in their life. So even though they've got no other urinary symptoms, 1 in 3 people, we think, will have an episode of incontinence for whatever reason. So, NHS England back in 2018 stated that continence was an important component in a person's health and well-being at any stage of their life. And I think that any stage of their life is a big thing for people to remember. Lots of people associate incontinence as going with the elderly. It's part of aging. You'll often hear people say, "Well, it's my age. I leak a little bit of urine, but I'm getting older now. I'm getting up 3 or 4 times a night, but I'm getting older now." It's not necessarily the case and isn't normal. So as children, what is normal is that we teach our children to become continent. We're not all continent when we're born, as you know. We teach our children to become continent, and for various reasons, for example, if a child's got spina bifida, there might be a failure to acquire that ability due to nerve damages and things like that. And so these children don't ever become continent, which obviously has a huge impact on their schooling and on their education and on their life in general. These children who fail to gain continence can't go on sleepovers with their friends, so easily because of fear of wetting the bed or what have you. So we do need to teach our children to become competent, and it's part of their ability to become fully functioning adults that we aid them to do this. Adult incontinence is also a huge psychological issue for people. Gives them a big loss of self-esteem, and they report lots of depression. People with incontinence issues. It affects what jobs they can do, whether they can go to work, whether they feel they can go to work. I've seen relationships break down. I know husbands and wives, that the husband doesn't know that the wife wears incontinence pads. Still in this day and age, it's something that gets hidden, and can have a huge impact on people's lives. And then, like I said, we all seem to accept it in the elderly that incontinence is normal, but it's not. Um, it's probably, as we say, as a result of some other medical issue that they have. But what we do tend to do in this country is put people in incontinence pads or put a catheter in, which again have their own morbidity problems. You Patients with long-term catheters in to help with the bladder um, are at such a high risk of urinary tract infection and all of the problems that go with that. Catheters block or leak. Or we put patients into incontinence pads, and if they put themselves into incontinence pads and they're not the correct incontinence pads, you're going to risk things like tissue damage. If their pads are leaking or their catheter isn't working properly, there's going to be a risk of falls trying to contain their incontinence. So it's important that we remember that it's not just part of going older. We need to find out what is causing these people to become incontinent. Um, so, how common is it? As we say, NHS England tell us that there's an estimated 14 million men, women, and young people and children living with bladder and bowel problems here in the UK. It's estimated that of those 14 million, 61% of them are men in the general population, and are experiencing lower urinary tract symptoms. So this tends to be men who are reporting a slow flow, starting to get up at night, things like that. 34% of women are currently living with urinary incontinence, and I suspect that's quite underestimated in both cases, men and women, as to actually how many people out there, because it is still a very taboo subject for people. Okay, so with NHS England, that was the bladder. Let's look at the bowel. So 6.5 million adults in the UK suffer from bowel incontinence, and 1 in 10 of the population are affected by fecal incontinence. Fecal incontinence is associated with age. As we become older, around 15% of over 85-year-olds living at home have some form of fecal incontinence, and that could just be that there's some fecal smearing, and that increases hugely, with a wide range of between 10 and 60% in residential and nursing homes, of residents having fecal incontinence. So that's very variable, but again, a huge number of people in the UK. So that's how many of us are affected. So it's about 1 in 3, 1 in 4 of the population have got a continence issue. So I just wanted to talk to you about the different types of incontinence and perhaps some reasons as to why that can happen. So urinary incontinence, we tend to describe urge incontinence of urine as a sudden intense urge that can't be delayed, and it's usually followed immediately by an uncontrollable loss of urine. So you've all of a sudden got the urge to go to the toilet. There's really nothing you can do about it, and quite often people will say by the time they've thought about the fact they need to go to the toilet, they're already leaking urine. It's a very different to having just a strong urge to go to the toilet that's just probably generally built up over time, and you've delayed going to the toilet, and then it becomes quite uncomfortable, and you definitely need to go. This is a sudden onset. Can be caused by a number of different reasons, and quite often patients with MS and spinal injuries, Parkinson's, those neurological diseases, because the nerve pathway between the bladder and the bowel is being interrupted by these conditions. It's just not allowing the bladder muscle to function properly, and right the way through, and tends to be in younger generations more of a lifestyle and dietary trigger for these symptoms. And we all think about caffeine making us want to go to the toilet as soon as you put your coffee cup down. And caffeine does affect some people, but it's also important to remember that it doesn't affect all people. So just telling somebody not to have a cup of tea ever again, if that doesn't make their bladder symptoms better, it's not the tea. You have to remind them to drink. So in clinic here, we tend to say to people, just don't have a cup of tea for 3 days. And if it's no different, it's not the tea, then have a look at the coffee, because the caffeine in the tea and the coffee are different. And I know lots of patients that can drink the strongest, blackest coffee in the world, but one whiff of a tea bag and they're run into the toilet. So just uh, be sensible with it. Don't cut out. Life's too short to cut out all the nice things in life that you need. The other thing, especially with the younger generation, is their intake of artificial sweeteners. We know that aspartame, the sweetener that goes into anything that says no added sugar or diet, we know that can stimulate the bladder to contract of its own accord, giving them these urinary urgency and frequency symptoms. There's also lots of other foods, fruits and vegetables that we can link to. But I think that needs to do those simple things. Have a look at your caffeine and your sweetener, and if that's not, talk to your continence team about other stimulants that could be there. So we know that urinary tract infections will cause an inflammation within the bladder, like any infection, and then again that interrupts the bladder receptors, causing them to contract. And I'm sure everybody knows that feeling when they've had a urine infection, that if all of a sudden you want to go. And you try and stop it because you know it's going to hurt so much when you do pass your water. But having an incontinence episode when you've got a urinary tract infection isn't so abnormal. It's a normal reaction to have an infection. And likewise, people with prolapsed ureters or prolapsed rectums will have issues with a change in the anatomy, allowing the bladder or the bowel to empty properly, so that you're not getting these other symptoms of a strong sudden urge to go to the toilet. And you can have urinary urgency, and you can have fecal urgency, just the same. Um, Next, we'll move on to stress incontinence, and this isn't stress as into, oh, my life's so busy and I'm stressed psychologically. Um, stress urinary incontinence or stress fecal incontinence is more to do with the pressure that the muscles are being placed under. So when you cough or sneeze or you lift something heavy, your abdominal pressure, your internal abdominal pressure will change because of the effort that you're putting into to do that activity. And along with that comes a small volume of urine or a small leakage of feces, just from that pressure. It usually happens because the sphincter muscles of the bladder or the bowel have been weakened by anatomical changes such as the prolapses we discussed earlier. If there's been trauma in childbirth, that can have had an effect on the sphincters, and urological surgery or radiation treatments for cancers and things can have an effect on how well these sphincters, which are just muscles that open and close and allow us to wee and poo, um, and keep us dry and clean. They get damaged. So stress incontinence. Overflow incontinence. Lots of people don't think about um, overflow incontinence, but its main symptom tends to be that when it's related to the bladder, of bedwetting at night. Patients will often say they've got no problems passing their urine in the day. They the flow might be a little bit slower, but they don't ever feel that the bladder's not emptied properly. They're peeing good and usually do pee really good volumes of urine, with that, what they don't realise is that very slowly the bladder isn't emptying properly, and that volume that gets left behind slowly over years gets bigger and bigger, and just stretches that bladder muscle, so it becomes even less powerful in being able to squeeze and squeeze the urine out. So often they've got no daytime symptoms, or they'll start waking at night or wetting the bed at night. Because the bladder is so full and it's then just overflow. It's almost like during the day they're just skimming the top off. And likewise, overflow incontinence with regards to the bowel. These are patients that have usually got chronic constipation issues, and the constipation is quite high up in the bowel, and there's just some fecal leakage around, so that they think they're passing a soft watery stool, and actually it's just an overflow, and the constipation actually needs to be dealt with. Um, so for both of these cases, it's usually as a result of obstruction or nerve damage, and is quite common in diabetics and multiple sclerosis patients, spinal cord injury patients, just because of that nerve damage. Next is functional incontinence, as we will call it, and these are nothing to do with bladder and bowel function. So these patients will have normal functioning bladder and bowel, like the rest of us for most of the time. Their problem is that there is a physical or psychological reason as to why these patients don't reach the toilet in time. So they get the normal urge to go to the toilet. It's just that their mobility is so poor that they just take so long to get there, or if they've got psychological or things, so patients with Alzheimer's forget where the toilet is, or they get the urge and they've forgotten what that signal actually means. Then it's a functional issue, and you need the help of your continence physios and the OTs, the whole social group out there, in finding aids to help these people go to the toilet. Sometimes if you've got patients with dementia, just having things on the toilet door, with a picture of a man and a woman might not necessarily recognise to them that this is the toilet, and they might just need a picture of the toilet. And there's all sorts of issues about dementia patients being able to go to the toilet, even down to if the colour of the floor is wrong for them. It just depends on how these people are perceiving things. So functional incontinence is usually a result of more of a physical or a mental impairment rather than a bladder or bowel function issue. But just as important, obviously, if they can't get there, they're more at risk of falling, trying to get there because they are aware of what is going to be happening. They are aware that they are going to wet themselves in front of everybody before they reach the bathroom. So very upsetting for lots of people. Iatrogenic incontinence sounds very, very fancy, but really what it means is it's drug induced. It's something that the medical teams, the hospitals have done to cause you to be incontinent. You weren't incontinent before you started this medication, and now you have become incontinent. So, sorry. Drugs such as muscle relaxants and nerve system blockers result in the nerve signals operating the sphincter muscles for the bladder and the bowel. It affects how they work. So the ability to hold on to urine or feces is a lot harder for the sphincter, and sometimes fails. Other drugs such as antihistamines, which you take for your hay fever, they block the transmission of nerve impulses to and from the bladder, and we do use them in some bladder treatments to help control some symptoms, but can have an effect on the way people pass urine. So they might um, sort of have a stop-start flow, or start losing the sensation that they actually want to go to the toilet. So it's important to keep an eye on these things. And if your bladder or bowel symptoms change with a new medication, go and speak to your GP about it. Have a look on the information leaflet. Talk to your pharmacist, saying, since I've started this medication, this is happening to my bladder and the bowel, because drugs can have a huge influence on the way that the bladder and the bowel work. Don't worry about it. Your pharmacist is going to be able to say, yes, that's a common side effect of the medication, and either look at perhaps trying an alternative, or explain to you things like the diuretic tablets that you need to take excess fluid out of your system. Then yes, it's going to give you urinary frequency in the morning when you take them, but that will wear off. And if you have to go out in the morning, tell you whether it's a medication that you could take in the afternoons, and control your symptoms with timing of your medications. So there are things that we can try to help you. So, having looked at the different types of incontinence, it's about looking at incontinence and how this contributes to your risk of falling. So the Journal of American Geriatrics back in 2000 published a report that rushing to the bathroom was increasing the risk of falling, which then increased in their results of fractures, and concluded that by diagnosing and treating urge incontinence in patients, they actually decreased their fracture rates. So urgency to avoid, as we all know, is going to make people rush to the toilet, and if they're in unfamiliar places, if they're staying at somebody else's home, or even just something simple like you're clearing out the spare room and there's boxes still on the landing, making that normal clear pathway to the bathroom cluttered and dark overnight is going to increase people's risk of falling. Obviously, wet floors. Not only a risk for the person that's leaked and slipped on the floor, it's also then a risk of falling for the person that's going to then go and try and pick them up. So slip hazards are obviously a common occurrence with people with incontinence. Medications we use to stop urgency to pass water do have side effects and can cause your blood pressure to drop when you go from that sit to stand. So it's a case of sometimes you might just need to warn people that they need, if they're lying on the bed, they need to sit on the side first and then stand up, or just take their time in standing up and use aids to help them stand up so they're not straining so much, and warn them that it might make them a little bit lightheaded. I think sometimes if people know, they then don't panic and they just give themselves that time. If they don't know that it could do this, they start panicking, stop taking their medications, and so forth. We all know how it feels if we wake to go to the toilet at night, but can you imagine having to do this 4, 5, 6 times at night, and effects this will have on your quality of sleep? So you then get more and more tired during the day because your sleep is so interrupted at night, and not only are you then at risk of falling at night because you're getting up in the darkness so frequently, but you're increasing your risk of falling during the day because you're so tired. Medications to help us sleep at night, unfortunately don't stop us having the urge to want to go to the toilet necessarily, but what it does do is when the urge for going to the toilet wakes you up, you're a lot more drowsy, because of the effect of the medications, and this has an obvious effect on your risk of falling, or obviously sometimes it will stop people from waking up with the urge at all, and will cause bedwetting, and then you've got the whole issue of having, if you do wake up or in the morning, there's the whole changing of the bed, and um, lots of people do still try to hide it, and try and do this without somebody knowing, and get themselves all tied up in their sheeting. So medications don't always happen. Um, Making those trips to the bathroom at night, we know that people try not to turn the lights on. Husbands and wives often come into clinic and say, I don't wake him up because I don't put the lights on. Obviously, if we're not putting the lights on, there is that extra risk of a trip. Just something simple like you can't see the cat or the dog on the carpet, and you trip over them. So we should always try and make sure that the pathways to the bathrooms are clear and well lit. Now, urinary tract infections can cause incontinence. This is something that is a result of the urinary tract infection, and should discontinue once that infection has been treated. However, again, if you've got patients that are getting regular urinary tract infection, obviously the confusion and the drowsiness that comes with that sepsis is again another um, um, risk of falling, especially it's especially common that the elderly become quite confused when they get a urinary tract infection. So how can we try and perhaps help? um, you know we can try and manage some of those symptoms, but there are things that we can do environmentally. And so I called this section environmental changes, because they are going to actually be the changes that we're going to make in the home and the environment around us, for managing falls. So have a look at adding sturdy arms, rails next to chairs and beds, as we say, to help those people to stand up that have difficulty in standing. Make sure they're getting their balance before they start off walking. Handrails on stairways and things like that, in the shower, next to the toilet. People forget that you have to be quite powerful in the legs to be able to sit yourself down and stand yourself up from the toilet, without having anything to push on. It's not like getting up from the arm of the chair. So things, having a look. Is it easy to get on and off the toilet? consideration of things like non-slip mats on the floor and at the bedside for people who have urinary incontinence, so that it's not going to go. They're not going to worry that it's going to go all over their carpet, but it does need to be something that is non-slip. There we go. Keeping, as we say, the pathway obstacle free, and check that there is appropriate lighting on the way to the bathroom. Leave a night light on the corridor and in the bedroom, so you haven't got to turn the full lights on, and you can have a pathway to follow to your bathroom. You can see that the floor is clear, and avoid throws and rugs. There are people out there that love a rug on their floor, but rugs are trip hazards, and so if they must be used, just make sure for anybody that's a little bit unsecure on their feet, whatever their age, that they're secured with a matting tape underneath. So just very simple things, nothing hugely, and stuff that your occupational therapists and your physiotherapists can help with. And another thing is, make sure you've got good shoes on. If you're a little bit unsteady on your feet, you definitely shouldn't be wearing flip-flop type slippers for going to the toilet. And if you're getting up regularly at night, I would suggest you're probably better to walk there in bare feet than loose fitting slippers. So individual changes that we can make is that we can all um, speak to the doctor or the pharmacist about a review of our medications. Like I say, if your mum or your child or yourself has started to have episodes of incontinence, and you think it can be related to a medication, don't be afraid to go and ask for a medication review. There is probably something else that can be tried, and if that's truly not the case, at least they can refer you to a continence clinic, so we can see if there's anything we can do to help you manage that. There is should It's nothing to be ashamed of. Um, Improving your balance and your strength. So just gentle exercise, things like yoga classes. I know Pilates classes, people tend to like, just to improve on your general core strength and your leg strength. We're not asking you all to go out there and become the next marathon runners. Just try and get some gentle exercise, because it will help improve balance and strength. Schedule an eye examination. If you're thinking you haven't had your glasses looked at for a little while, or as I do quite a lot in my clinic, give people a wipe, just to wipe their glasses, because sometimes you can see that the glasses are really quite misted over, and if you can't see clearly, you've got a greater risk of having a fall. Ensure that the person that's having the incontinence problem is wearing suitable clothes. And this is hard, because if it's somebody that wants to maintain their independence of going to the toilet on their own, but they've got a weakness in their hands or in their arms, they need to have trousers that aren't tied up in the middle, haven't got zips and buttons, something that they can get down easily on their own, and good footwear, as we said, to stop them slipping. But also, as nurses, I know as nurses, we like to put big pads on patients. Well, it doesn't matter how much you're leaking. We like to put a big old pad on there. What you have to remember is that having those pads and those net knickers on to keep that pad in place is actually really hard, and delays people from being able to get to the toilet on time. So they're more likely to leak into their pad because they can't get it off quick enough. In the pad world, small is beautiful, and continence teams spend a long time assessing how much urine people are actually leaking, so that they can have the smallest pad that will actually hold their leakage volumes. Um, and allow people to get their incontinence products removed in time, and assess. whether other continence products, incontinence pads aren't for everywhere, and there are alternative um, 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 continence aids out there, and I've got some pictures of some um, here for you. So these are your disposable incontinence pads. So these are the ones I most commonly use. They're quite small pads, and each of these will hold around a mug full of, of urine before they start giving the risk of leaking, and they get a bit heavy to hold in your pants. And these pads can just go inside your underwear. You do need to have proper fitting underwear, and the assessment needs to be done by a continence advisor or a continence physiotherapist. They come as wearable products. These aren't available locally here on NHS prescription. It will be these two types of pads, but you do need to have proper tight fitting underwear in order to hold these pads to the body. Incontinence pads aren't designed to leak. And the disposal ones are generally made of a pulp and a superabsorber polymer, and it's these little absorbent polymers that do all the work, and they are within the pulp absorb all of the urine. They can hold huge quantities on a weight basis. So make sure your incontinence pad fits properly. The snugger the fit, the better it's not going to leak is my general rule. So if you can hold that pad tight to the body, it's not going to leak, and it's not going to smell either. Lots of people worry about incontinence pads smelling if they leave them on too long, but if you've got it fitted properly, that shouldn't be an issue. And the other thing is, make sure that you prepare your pad properly, because these pads come in packs, and they've usually been vacuum packed. So when you open them, make sure that you open the pad, and I say pull it open and then fold it in half vertically, so that you've got the long length of the pad all folded, and it will make almost like a channel in the absorbent part of the pad underneath. One, so that you can fit it between your legs and get those slip guards, those leak guards, right up into the groin, and then fold the panel front and back to fit. Or obviously with the men's pad, you can then cup it onto where the tip, where the penis sits, and underneath to stop leakage. So just make sure those pads are on and held in place, either with the mesh pants or with a good pair of good old-fashioned Y fronts to hold it in place. So they're your disposable products. Down here, I've just put, you can just get simple frames to go over toilets to help people get themselves on and off the toilet, and things like seat risers are enough for some people. But again, your continence teams will be able to help, and occupational therapists will be able to help with these aids if you do need it. Lots of people don't like the idea of reusable incontinence pads, both from a personal point and from an environmental point. And so you can get reusables. They are improving over the years. They're not the big old plastic things that they used to be, like the rubber knickers. They look and feel like proper underwear, and they've just got rewashable pads that you can place into the garment and remove and wash and reuse. Obviously, they don't absorb the huge quantities that some of the reusables, but if you've got small volume leakage to a moderate volume leakage, it's often enough. Next, I would say are the urinals. There's a male and female urinals. It's just a bottle that you can use in bed or beside the bed for some people. I often advise my patients, you can get like a gel, um, a, a powder that you can put into the bottle so that the water will become a gel when you wee into it, so it reduces any kind of spillage risks. But some of them do come with lids on. Obviously, with the absorbent granules, you do have to be careful with people's mental abilities, if it's for young children, and or people with dementia problems, that they don't try and eat the absorbent capsules. Um, has been reported. I've never seen it personally, but obviously from a safety point of view, we just need to make sure this what the products we give people are going to be safe for them. Um, if you don't want urinals, you can have well, men can have what's called a urinary sheath, and this works a little bit like a condom, and you can attach it to a leg bag. Um, so this just goes over the penis and on the leg bag. And the thing is with urinary sheaths is that if they fall off, it's because they've not been fitted properly. In my books, um, not all men, contrary to popular belief, are the same shape and size. So these sheaths come in different widths, different lengths, different types of fittings. There will be something that we can use for even men with retracted penis. There are things we can do to help prevent these men needing catheters. Sometimes a urinary sheath will be called an external catheter, but do get them fitted. New on the market, it's not widely available, but they are around, and obviously continence teams can investigate getting them for you if it's something that you want. But this device here is called the female external catheter. It's called a pure wick, and this just sits between the legs of ladies who've got incontinence. Tends to be more for bed-bound patients, but I know patients in wheelchairs that know when they want to go through it, they just physically can't get there, but they've got enough dexterity to put this between their legs and turn the suction on, and it will just siphon away any urine that they pass. And obviously, if they're unwell and bedbound, you just have this on a permanent low suction, so any urinary leakage is just permanently taken away, and it's quite good for helping manage people with moisture lesions from sitting in wet pads or inappropriate wet pads, because you shouldn't get moisture lesions if you've got the correct pad. And so this is an option, and I think it will become more popular in the future. And then you have stress incontinence devices. So for people with anatomy problems or weak sphincters, for ladies, we have the device here in the green box. It's an intravaginal device, and what happens is you put it in a bit like a Tampax, and it just sits just inside the vagina and helps support the urethra and the bladder neck, so that when you cough and sneeze, um, it will stop leakage, and means people don't need to wear incontinence pads. Very good for ladies that want to go to keep fit sessions and jump on trampolines and things like that. It's there, and these can remain in situ for several hours without any difficulty in wearing it at all. And obviously for men, sounds horrendous, but these top two on the right here are called penile clamps. Um, you can see that the yellowy coloured one is literally a clamp that goes and clamps down the urethra and has the effect of closing it off, so that any leakage will sit behind that clamp, but a little bit more pleasing to the eye and a little bit more comfortable for the men, I think. There are alternative devices that do the same sort of thing, but they're just not quite so bulky. So there are things that we can try and use for people to contain their incontinence, that means that they haven't got pads and they haven't got, more importantly, catheters, and it's things to stop them having to get up overnight and worrying about wetting the beds, and all of the things that we can do to stop people rushing to get to the toilet, is going to be a reduction in any kind of falls risk for them. Um, so I think that's it from me. So I just wanted to say thank you. I'm sorry this slide's not very clear, but thank you for listening. And I hope something from today will help with both symptom control, if this is a problem for yourself, and as to why this might be happening, and give you some ideas on getting some help for yourself. However, as this says, if my body was a car, I'd trade it for a newer model, because every time I cough or sneeze, my radiator leaks and my exhaust backfires. If this is happening to you, hopefully I've given you some guidance on how to stop that happening. And of course, if you're not backfiring and leaking, we're hopefully keeping you on your feet. Thank you very much, everybody.